Hello, everyone, and welcome. Thank you so much for being here today. For those of you who don't know me, my name is Krystal, and I am a health and wellbeing consultant here at Borislow Insurance. I'm excited to present to you this month's topic as diabetes awareness. We will present various topics as it relates to diabetes, but throughout today's presentation, I invite you to engage in the polls and the post survey. It's just for fun. There's no test or anything like that. And then following today's webinar, we will share a recording link that you can share with others and your loved ones. And as a reminder, this is for educational purposes only. As a disclaimer, I am not a doctor. So if you have any specific questions, please reach out to your primary care physician or your human resources or directly to your carrier for anything that comes to mind as we go through today. In the background, I have my team, so feel free to utilize the chat function or Q&A as Travis will be behind the scenes answering those. If not, we will take a look at them at the end. So Borislow Insurance focuses primarily on employee benefits and specifically health and well-being. We focus on consulting various customized education and assessments and help strategize. We offer innovative behavior modification solutions, live or on-site webinars, classes, and demonstrations such as today's, and we are a medical carrier wellness liaison. So if you're interested in expanding your health and well-being, please feel free to reach out to us or directly to your human resources who can contact you with us specifically. On today's agenda, we will cover diabetes awareness, the causes, symptoms, risk factors, as well as testing, management, and prevention. So I always like to engage in polls. So let me pull up the first one. Okay, according to the CDC, diabetes is the blank leading cause of death in the United States. Is it the number 1, 3, 5, or 7? Give just a couple more minutes to participate. And I'm going to go ahead and end the poll here and share the results. So thank you so much for participating. It is actually the 7th leading cause in the United States. So great job there. Thank you so much for participating. Let's start on focusing on awareness. So diabetes is a chronic health condition that affects how your body is able to turn food into energy. The food you eat is broken down into sugar, which we will refer to as glucose as well in this presentation. And then it is released into your bloodstream. So as your blood sugar goes up, your pancreas actually releases insulin. This is what allows the blood sugar to enter into your body's cells and then use it for energy. Diabetes is when your body doesn't make enough insulin or can't properly use insulin. So there are various types. Type 1 is when your pancreas doesn't produce enough insulin. This is typically found in children, teens, or young adults. And type 2 is probably the most commonly known, which is when your cells don't respond normally to insulin, which is known as insulin resistance. So about 90 to 95% of Americans with diabetes have type 2. And then lastly, there's gestational diabetes, which can develop during a pregnancy in women who don't already have diabetes to begin with. So this is probably typically around 2 to 10% of pregnancies that are affected by gestational diabetes. There are a few causes. So a few that are listed include obesity, physical inactivity, genetics, of course, but please keep in mind genetics only plays 3% of a role in developing a chronic disease. High blood pressure, abnormal cholesterol levels, typically in the age of 45 or above for type 2 diabetes. Pre-diabetes is when the symptoms are not addressed and it is left untreated. And then of course, if you develop gestational diabetes, then you are prone to developing a type 2 as you move forward, or giving birth to a 9-pound plus baby can also contribute. So let's look at what some of the symptoms are. Some of them might include, please keep in mind diabetes symptoms vary depending on how much your sugar is elevated. So individuals with type 2 may not actually initially experience any symptoms. However, those with type 1 may experience severe symptoms that develop quickly. So a few of them could include excessive thirst or frequent urination, extreme hunger, unexplained weight loss, ketones in your urine, which can be utilized or found using test strips, fatigue, blurred vision, slowly healing sores, and frequent infections such as in your gums or your skin or in your vaginal space. So keep in mind, these are things that you might want to look at that you might want to talk to your doctor about. Or keep in mind if you know someone or you yourself is diagnosed with diabetes. So I invite you to engage in our next poll. Diabetes can lead to eye diseases, including retinopathy, macular edema, cataracts, and glaucoma. True or false? We have one more moment to participate. Thank you for engaging, everyone. I'm going to go ahead and end the poll here and share the results. So absolutely, that is true. So great job, everyone. So let's take a look at what some risks might be. So if left undiagnosed or untreated, there are several serious complications that can arise, such as heart and blood vessel disease, blindness or eye disease, which we just talked about, kidney failure, nerve damage, osteoporosis, again, skin infections, Alzheimer's disease, and gum infections. So please keep in mind that if left untreated or undiagnosed, these could lead to more severe complications. So there are testing that we can do. So it's recommended, again, that anyone that might be 45 or over consider getting tested for diabetes, as well as those who might be under 45 but are maybe overweight. So again, talk to your doctor for your specific screenings and any recommendations that they may have. You can talk about the symptoms that we talked about or reviewed and any causes that might be of concern. So there are a few different tests. A fasting plasma glucose test measures your blood glucose or your sugar after not eating for 8+ hours. An oral glucose tolerance test measures blood glucose after at least 8 hours without eating and 2 hours after drinking a glucose-containing beverage. And lastly, a random plasma glucose test is when a physician checks your blood glucose regardless of the last time you ate. It is also administered in addition to any assessment of symptoms such as we reviewed previously. Any positive results should be confirmed by repeating the fasting plasma or the oral glucose tolerance test on another day. So again, we recommend that you go for your annual visits and you talk to your doctor and talk about potential screenings and diabetes testing as well. As we know, if it's caught ahead of time, it could save a lot and avoid some of those more severe complications. So I invite you to participate in our next poll. Is there a cure for diabetes? Yes or no? Give just a few more seconds to participate. Thank you, everyone, and great job, absolutely. Let me share the results. So there is no cure as of yet, but scientists are working on a weight management study, which helps people put their type 2 diabetes into remission. And remission is when blood glucose or your blood sugar levels are in a normal range again and can maintain that normal range level. However, keep in mind, it does not mean the diabetes has gone for good. So let's talk about management. So if diagnosed with diabetes, it's important to follow a stringent daily plan to ensure that your blood sugar is kept in proper range. So although it is a lifelong condition that requires constant treatment and management, there's a lot that can be done in order to prevent further health complications. So here are a few options that you might want to follow if you yourself or maybe a loved one or a coworker might be diagnosed with diabetes. It may include following a meal plan or increasing your physical activity, taking medication and insulin if prescribed, testing your blood sugar, carrying a glucagon kit, as you'll see in the picture, which is in case of low blood sugar emergency. So like the type 1 where their symptoms can progress quite quickly in children and young adults, you might want to carry this kit in case there is an emergency. And as you can see, there are instructions right in the kit itself. So again, if you or a loved one or a coworker or a child might have this kit, they might want to include some education in those around them in case they are in need of the use. It's also a good idea to keep records of your glucose levels throughout the day and any physical symptoms that might arise that might feel abnormal. And again, as we talked before, educating yourself as well as loved ones and those around you. And as with any health and well-being initiatives, we like to cover the risks to increase awareness and encourage preventative measures. I'm not sure about you, but I'd much rather spend my time and money on things besides the doctor's office and treatment. So hopefully you'll find these interesting and maybe one that stands out to you. So taking the following precautions to help decrease your chances of developing diabetes include getting a routine diabetes screening test, as well as regular eye exams. So again, we talked about eye diseases could be a more severe condition. So your eye doctor plays an important role in diabetes diagnosis as well. So going for your regular routine annual screenings at your doctor's as well as your eye exam. And then staying current on your immunizations because diabetes can weaken your immune system. So again, 'tis the season of flu season. So if you haven't been yet, maybe consider getting the flu shot. And then of course, making healthy food choices. So foods that are low in fat, like fruits and veggies. And then whole grains also release nutrients, which helps naturally help decrease your blood sugar levels. So as the nutrients are released throughout your body has time to actually process without getting into insulin resistance. And then again, monitoring your salt intake. So choosing anything with low sodium will help as well. Increasing physical activity. Again, we always aim for 30 to 60 minutes of moderate physical activity per day. Keep in mind, it's always an option to break it up and follow a schedule that works for you. So if you need to do multiple sessions to get 30 minutes, maybe a 5 or 10 minute walk here or there, every ounce of exercise counts. But it's important because it lowers your blood sugar level by moving sugar into your cells where it can be utilized for energy. Oral hygiene, so taking care of your teeth because individuals with diabetes are prone to gum infections. Reducing or losing any excess weight, stop carrying it around, every pound counts. That will come into play with the food choices and physical activity, of course. And then pay attention to your feet. So high blood sugar from diabetes can actually cause nerve damage and low blood flow. So keeping in mind, just paying attention to your feet throughout the day. Substances, so don't smoke and drink responsibly. So keep in mind, alcohol has a lot of sugar in there. And lastly, stress management. So your body's hormones are produced in response to stress, which prevent insulin from working properly. Also, stress can make it easy to dismiss healthy behaviors. So maybe set some stress limits and boundaries, prioritize tasks, utilize relaxation techniques and tools, and get plenty of sleep. And then I'm just curious if you would like to engage in our last poll. Which preventative measure will you utilize today? Maybe it's screening, immunizations, food choices, physical activity, oral hygiene, lose excess weight, pay attention to your feet, or substance and stress management. So again, go ahead, I invite you to participate. There's no right or wrong. It's just something that, as we build this awareness and educate ourselves on diabetes and things that we can control, such as preventative measures, which ones stand out to you, and something that you can take and actually work towards today after this presentation. So I'll give one more moment to participate. I know there are a lot of choices and you're probably doing multiple. I'm sure you've already brushed your teeth today, so that's already a great preventative measure. So go ahead and end the poll here and share the results. So great job, everyone. Food choices make a big impact, and physical activity as well. So thank you so much for sharing. I hope that you enjoyed today's webinar. Again, it's for educational purposes, and if you have any specific concerns, we encourage you to reach out to your doctor or your human resources or your direct carrier and take an investment in your own health and well-being. So again, thank you so much for being here today. We hope you enjoyed today's webinar. Have a great day. Happy holidays.